can observe that since our last strike action, we have been very peaceful in the health system. It's not because we don't know we cannot make trouble, but the permanent secretary appealed to us. After the permanent secretary's appeal, we kept the peace, and he tried to implement some of the court judgments as contained in the court judgment, NIC judgment. So thereafter, when the new ministers came, the present minister also made same appeal when we paid him. We went for an audience with him. He also made same appeal. So we are very desirous of maintaining the peace. But recent events have started agitating our members, vexing our members. For instance, one of the items in that court judgment was that the ministry should liaise with PCAS and IPs to ensure that they pay skipping and promotion arrears to GSU members that are yet paid, that are being owed. But recently, when the ministry says it does not have money, but when the ministry one way or the other can lay hands on money, they have used that money to pay medical doctors who are not, by law, entitled to earning the skipping. But we that ought to earn that skipping have been denied. This is clear provocation. It's clear provocation. And our people are beginning to be agitated. So we said, because we have made a promise to the permanent secretary and the minister that we will try to keep peace as much as we can, we are going around now, institution by institution, to explain to them and to seek a little permission from them, a little time, so that we can get back to the ministry, so that the ministry, as promised, will begin to treat all sides, in a fair way.
Security situation in the country where a lot of money is being spent on security is not allowing government to actually reach at the level we have wished to reach. And at this juncture, we want to pray to Almighty God to help us solve this security problem, so that a lot of money that is going into security, if that money is invested and brought into health sector, there will be significant improvements in health sector. Like you all know, most chief medical directors of federal tertiary institutions are all shouting about funding. It is very true that the funding is low, but we know that this funding is low because the money is just not there. And the little money that is there is being given towards security of our country. Because without security, we cannot do anything. The security situation of the country is worrisome, and a lot is being done. And we hope and pray that one day we will go beyond this level of security. For we all know that in as much as we continue to have this kind of security situation in the country, not only health, a lot of other sectors will suffer sincerely, be it education, be it agriculture, because once there's no security, you can't talk about the children going to sit in the classroom, the health workers sitting in the hospitals and all that. But as soon as security situation improves, I believe that a lot of money should come into health and education for us to be able to develop our health institution. I also like to sincerely salute you, Comrade Joshua, and your group for maintaining a peaceful atmosphere actually in the health services in the last 2-3 years. We've had it smooth, and the Nigerians are happy that there were no incessant strikes any longer. And I must also salute you for the method you're doing now to solve the current problems that are likely going to cause troubles in the future. This method of going round to share the problems with the chief medical directors of area tertiary institutions, with the public, is a very good method. Because where you have straightforward cases, people will be able to present these cases to the authorities that be to get the problem solved without any strike. We as chief medical directors will be happier to resolve problems without strike.